This video is for the INICET May 2026 aspirants, and the whole motto of the video is to give you an idea that for which subject you are preferring, what rank to target for, and how many corrects to target for. Because if you don't know that, then you will be directionless in your preparation. So let's see the expected cutoff of INICET May 2026. This is a predictive cutoff because it will change, because I have taken the cutoff of INICET November 2025 round 2. राउंड 2 इज मोर और लेस प्रेडिक्टिव. राउंड 3 में कट ऑफ और भी ज़्यादा दूर जाता है और भी ज़्यादा नेगेटिव शिफ्ट होता है. सो ये वाला बेसलाइन है, ये वाला सेफ साइड रहने के लिए ये वाला कट ऑफ रखा गया है. Because it is a predictive cutoff, as the seat matrix is going to change, and in the November INICET 2025, there was NEET PG counseling overlap. So a bit of negative shift could also be seen in case of INICET November 2025. Let's see the cutoff. I am only going to say the UR cutoffs. You can see the other category wise cutoffs also. And I will upload this PDF and the screenshots in my Instagram channel. So if you are not following me there, you can follow me there. The link is given in the description box below and pinned comment section. Urology was one of the top branches. Its cutoff was 184. Infectious disease was 172. Nuclear medicine is one of the most growing branches and it has very high packages if you just pass out. So its cutoff is 189. Medicine is 221. There is a negative shift compared to the other years of INICET. Dermatology is 226. Radio diagnosis, I was also surprised that 306 is the cutoff, but it is real. I have checked it twice. Respiratory medicine, it is 318. Geriatric medicine is 372. Pediatrics is 424. Neurosurgery 488. Plastic surgery 549. General surgery 715. Psychiatry 856. Critical care is 885. Obs and gynae 947. CTVS 958. Orthopedics is in 1027. Ophthalmology 1060. ENT 1124. Pediatric surgery 1173. After that, emergency medicine 1213. Trauma surgery 1228. Radiotherapy 1279. Palliative medicine 1481. Anesthesia 1529. So you have a lot of scope in the INICET also. If you rank in the top 1.5 thousand, you can get any clinical stream. Family medicine 2935. Lab medicine 2412. Physical medicine and rehabilitation 2492. Hospital administration 2961. Pathology 3795. Forensic medicine 4301. Community medicine 5370. FMT 5711. Pharmacology 6581. Microbiology 7630. Biochemistry 8891. Physiology in 9000, and anatomy finally in 10,000. Let's see the INICET May 2025 corrects versus the rank. This time it might change because the number of applicants is going to change, the quality of applicants is going to change, the standard of question paper is going to change. But this is just to give you an idea that how much number of corrects to do to get your desired branch. With 160 corrects, you can get a top 10 rank. 150 corrects, a top 100 rank. 140 corrects, a top 1000 rank. 135 corrects, top 2500 rank. 130 corrects, 4000, and 120 corrects, 10,000. 110 corrects, 28,000. Now, if you are preparing for INICET, you can go through my INICET previous year topic list, it is not that इस लिस्ट से पढ़ने से ही तुम्हारा INICET में सिलेक्शन हो जाएगा. It is a wrong concept. It is for that you don't miss any topic of INICET, because all the topics of INICET is mentioned here. If your notes is lacking any topic, then you will have to add that topic in your notes. Seeing from the main notes, you can add in the RR, or seeing from the chat GPT or explanation of the previous year questions, you have to add that topic in your rapid revision notes. Then only the notes will be sufficient and you will be able to get all the questions of INICET. So strike rate is 110 to 150. The link is given in the description box below and pinned comment section. And I also have a digital image bank which has 1850 plus high yield images. As you can see, all the previous year questions has been highlighted and marked as previous year questions. So when you review the digital image bank, you will get to know which are the previous year questions and which are the high yield images. With that, all the classical images are being mentioned which cannot be shown in the notes because of copyright issue. So this is up for today. I hope that you got an idea that which stream you are targeting and what kind of number of corrects you need to make, what kind of rank you need to make to get into your desired branch. Now you can see a video on how is NEET PG different from INICET, and NEET PG and INICET strategy video. So go watch them now.